Good morning, everyone, and thank you for being here today. It's a pleasure to be here. And my name is Barry Strive, and I'm a board of director of the Thunder Bay Regional Health Sciences Foundation, and I'm one of your MCs today. Yeah?
My name is Ann Donaldson. I'm with the volunteer board, and I will also be co-hosting with Barry. I think you're going to start.
I think you can.
Okay. The Family Care Grant started in 2009 at $30,000 and grew to $60,000 in 2011 as a partnership formed between the Health Sciences Foundation and the Volunteer Association. Today, we as partners are pleased to say this year we have $68,000. It is made available to fund grants to enhance patient care here at the Health Sciences Center. The funding has been made possible thanks to generous donors to the Health Sciences Foundation, as well as money being raised by the Volunteer Association, in particular, the Seasons Gift Shop. What I like most about this grant program is that it's very encouraging to help raise the funds and then see firsthand how they're being spent. I'd like to thank all the volunteers who work hard, and they really do, at raising money that goes towards these grants, and to donors who also believe strongly in the program. I think everyone can be very proud when they see the results of the work today.
Thank you, Ann. It's our pleasure to welcome you here today again to announce the recipients of the grants. Family Care stands for Care Advancement Recommended by Employees. The grants being announced today were requested by frontline staff who work closest with patients at the Health Sciences Center to fund items that enhance the exceptional care offered to each patient and their family. To ensure that the grants have a significant impact, each application requires the endorsement of a patient and family advisor, a manager, and an executive vice president. So yes, Ann, you are right. It is very gratifying to each of us involved with the program, whether we sit on the grant committee or are a volunteer or donor, to see the incredible impact these grants have. And the impact is great. We see that as we continue to receive more and more applications each year, as employees recognize the difference these grants have to patient care. This year alone, we had our highest number of applications. The number was 71, with requesting a total of $151,000 plus. So I'd like to think that this level of commitment from employees for their efforts to improve patient care is one of the reasons Jean Barkowiak chose to lead the Thunder Bay Regional Health Sciences Center team. Having said that, it's now my pleasure to officially introduce the new president and CEO of Thunder Bay Regional Health Sciences Center and the CEO of the Thunder Bay Regional Research Institute, Mr. Jean Barkowiak.
Good morning. By 9 days into the job and I already received checks. That's quite impressive. Thank you, Barry, for that kind introduction. To be sure, the reputation of Thunder Bay Regional Health Sciences Center in providing patient and family-centered care was one of the reasons I chose to relocate here to Thunder Bay. It's my pleasure to be here, to be able to attend today's announcement, where we will hear more about how our community is supporting care enhancements with the Health Sciences Center. That are the little things that are so important in really having a supportive care environment for our patients and their relatives. You know, in this environment, it's full of technology. I know it's very important for the doctors, for the staff, and for the patient's care. But sometimes it's the little things, as I said earlier, that really make a difference. They're not very expensive, but we're so pressed by other fancier priorities that we forget about those little things. So thankfully we have a foundation that's listening to our patients and their families and our staff request, and are coming to help address these demands. I think we're all familiar with the idea of a workplace suggestion box, and that's what these grants are like. Mind you, they take a little bit more effort than a simple no to write up these grants. But what's important is that anyone within our organization has the chance to bring an idea forward and receive a grant. It empowers our staff to think about how patient care can be improved. And as Barry mentioned earlier, now that this program has been running for several years, more and more people are seeing the impacts these grants can have in their unit and are taking the initiative to apply, which is wonderful. And it's becoming a challenge to actually determine who's going to be the winner, because we have so many requests. I'd like to thank the Health Sciences Foundation and the Volunteer Association for their partnership in bringing this grant program to life, and to the many donors and volunteers that made this funding possible. I'd like to thank all the employees who took extra time from their already busy days to submit an application. And believe me, this is a busy place. I was touring the unit, the emergency room last week. 89 patients on the unit. That's unbelievable. Currently, we have more than 450 patients in the hospital. Luckily, it's too cold outside, so the patients didn't show up in the ER. It's a little quieter, but it's still very busy. I know that there is a committee that meets to review all these applications, and with 71 submissions, can you imagine 71 submissions? I can only guess that there was arduous discussions going into the decisions that are announced today. So my thanks to each committee member. And if I may, I'd like, as my closing remarks, to recognize one particular person from the Health Sciences Center team, whose role in this process likely goes unnoticed, but without him and the work he does, none of the applications would get off the ground. He's a buyer in our purchasing department who provides the majority of the quotes for all the pieces of equipment that are requested through this program. If an application doesn't have a valid quote attached, it doesn't qualify. So please help me recognize Matthew Sage, and I hope I'm pronouncing his name correctly. Sai. Where is it from?
I'm so frustrated with you.
Yes. Where is it from?
Ukraine.
Oh, well, we're almost related. Mine's from Poland, right? So, and now let's hear from our MCs so they can tell you about what some of the grants funded this year.
Thank you, Jean. Well, we're pretty excited to tell you about the grants, so let's get started. This year, there were 39 grants funded. Here are just some of the fantastic ideas that were funded.
The Regional Stroke Unit, located on the 2C inpatient unit, is receiving several grants, including a portable mechanical lift to assist in safely moving patients out of bed, along with slider boards, which are needed when transferring patients to and from stretchers. Additionally, they are the recipient of a new vital signs monitor.
Our maternal, newborn, and NICU receive grants to help parents and infants as they navigate their way through the first days of their life. For support people who wish to remain with the new mom overnight, which apparently happens quite often, a new sleeper chair will be available in 1C, making everyone's night a little more comfortable. That's before they get home and realize what's going to happen to them. Additionally, a new bed will be available in the NICU parent room, again for family members to be with the new mom. They are also receiving 2 hospital-grade breast pumps and stands to provide a breastfeeding-friendly environment, as many new moms need to pump until breastfeeding can be established. Finally, to support the needs of babies who require neonatal abstinence scoring for maternal drug use, 2 new baby swings are being funded to help soothe and provide comfort to the newborns.
Thanks to the success of some previous family care grants, I don't think these next items will come as much of a surprise to some of you. Our pediatrics department will be receiving a new wagon and ride-on car for kids to ride upstairs to surgery or to various appointments throughout the hospital, making the trip more fun and much less intimidating for the little ones. As well, the department has received funding to implement a pager system similar to the one that is in place at our fracture clinic. Now, those waiting in pediatric outpatient will be able to move about the buildings much more freely.
Speaking of paging systems, the security department is receiving a grant to install a new buzzer intercom system with a closed-circuit camera at the main entrance. This will allow patients and families who come to the Health Sciences Center after hours to enter via the main entrance, as opposed to having to travel to the emergency department doors. This is especially critical for elderly patients, families visiting loved ones, and anyone wishing to enter the building on these bitterly cold nights who weren't aware that the main entrance is locked at night. Barry?
For sure. Our ambulatory care department is working hard to decrease wait times for patients visiting. So we were happy to provide funding for a Doppler unit that will be used by orthopedic, plastic, and vascular wound care specialists as wound care is evolving rapidly. Having one on hand instead of borrowing from another area will enhance care significantly. As well, the Lions Vision Care Center is receiving a grant for a new wheelchair accessible table for the slit lamp used in eye exams. Now, instead of needing to transfer to a different stool where they may feel insecure or uncomfortable, patients in wheelchairs can remain comfortably seated to have their exam, reducing the risk of falls and providing increased feelings of security.
Finally, our rehab department will be receiving 6 grants this year, continuing their tradition of successful grant applications. We're pleased to provide funding for a variety of small pieces of equipment that will enhance the care that's provided to numerous patients requiring rehabilitation services, including a power seat lift, digital timers, and a 4-wheeled knee walker, and several more. Let's give a round of applause for all these grants.
But guess what? We're not done yet, right, Ann?
No, never, never. Close, but not quite. There is quite a theme this year in the grant application in that many focused on seating throughout the facility. And so we're very pleased to announce that of the $68,000 being funded this year, over $18,000 is directed to a new seating arrangement in the building. Of the $18,000, this funding will be directed to new seating in our lobby, which continues a family care grant from last year. I think many of you have seen some of the new furniture, and we'll continue to replace it and match it. We're also doing waiting room chairs in our emergency department, elevated high back chairs for 2B unit, and for ICU, helping patients to get out of bed. New furniture for the children or the child adolescent mental health unit, specifically for the TV lounge, providing a more homey atmosphere. A motion recliner with locking casters for patients in surgical daycare who need to wait with their legs elevated. And bedside chairs in our very busy emergency department.
There's one other area that's also receiving funding for some new seating this year, and I'm very pleased to welcome one of our spiritual care providers, Lisa Leitonen-Ebushamu, to tell you more about what's happening just down the hall in our multi-faith spiritual center.
Good
Lisa.
job.
Thank you, Barry, for saying my name correctly. So I wanted to say some thank yous today as well. There's a lot of thank yous going around, but I wanted to say thank you to the Health Sciences, the donors to the Health Sciences Foundation, and to the work of the Volunteer Association that fund all these much needed projects that we have. In the spiritual care department, we're really excited to receive the funding we needed to build benches along the walls in our multi-faith center. The center is often used for smudging ceremonies by patients and families who practice traditional First Nations spirituality. During the past year, we've noticed that the furniture we currently have in the space did not allow for enough seating in the room to accommodate for larger groups who often smudge in the space. Currently, we can only accommodate about 8 to 10 people comfortably for smudging ceremonies and other ceremonies as well. With the new benches, we will be able to accommodate groups of up to 20 people. Furthermore, the new benches will fold up nicely against the wall, and we will be able to use existing stacking chairs that we have in the space for other services more comfortably. The furniture we have in the center right now is rather large and bulky and does not allow us to use the space in the many ways in which we would like to use it. And the new benches will allow us to use the space in a variety of ways with ease. And secondly, as it is right now, the multi-faith center looks and feels more like a cozy living room rather than a spiritual center meant for spiritual practice. And so the benches are the first step we are taking in renovating the space to make it more conducive to spiritual practice and well-being. And so thank you again to all the donors to the Health Sciences Foundation and to the hard work of the Volunteer Association who make these grants possible, as they really do help us to provide better support and care for the patients in this hospital.
Thank you, Lisa. We're very excited to hear about the updates on the benches. There's one other item we wanted to profile before we finish. This particular item is the polar opposite over the seating we were just talking about, as it's a piece of equipment hardly anyone will see, and we know how much of an impact it's going to have on the Health Sciences Center. So to tell you more, I'd like to invite the Manager of Laboratory Services, Georgia Carr, to give you a glimpse at behind the scenes grant.
First off, I would like to say a big thank you to the donors of the Health Sciences Foundation and the Volunteer Association for the funding. So why is this grant so important to the lab? Laboratory medicine is an extremely complex field with specialized disciplines. Advanced technology is part and parcel of the complicated testing that we perform each and every day. The lab employs close to 140 people. We're here 365 days a year, 7 days a week, 24 hours a day. We are licensed for over 100 tests, and last year alone, we tested 2.1 million individual tests for our patients. We receive thousands of patient specimens each and every day. So the fridge. Who would think? Obviously our old one broke. As you know, healthcare dollars are precious, and fiscal responsibility is paramount to ensuring resources are appropriately used for the patients of Northwestern Ontario. Our complex instruments could not run and would not be running if we didn't have a fridge to store our reagents, our calibrators, and our quality controls in. So, as simple as it is, a fridge is really, really important. We're very mindful of utilization. We're assessing all the time and trying to keep that under control. But in addition to that, we're extremely mindful of every step that we take in the lab. Every step is accounted for. And I thought I would put it in the words of Sheila, who I would love to give a round of applause, our biochemistry coordinator. And Marissa Kubinick was the one that suggested the family care grant. I didn't think of it. So thanks to both of them, although Marissa isn't here. In Sheila's words, in her grant application, she wrote, and thinking of footsteps, because the lab is laid out very lean and very efficient, it has to be, with the volumes that we see in relation to the staff that we have. Sheila wrote, each added efficiency for the staff results in a smoother workflow, resulting in the best possible turnaround times for patient results, particularly emergency and critical care, when timely results are so vital to patient care. So the lab is extremely humbled and thanks you from the bottom of their hearts, and can't believe that we got this funding. It meant the world.
Thank you, Georgia. I just want to say one thing. I think there should be an application coming forward to the Family Care Grant Committee to supply everyone with Georgia's wonderful colored shoes. I think they're gorgeous. They're amazing. Yeah. We'll expect that grant next year. Thank you. It's fascinating to hear what happens in the lab, And good to know that we're able to support the critical work taking place there. So as you can see from the variety of grants that have been presented today, there are a multitude of departments that will benefit from the generosity of our donors and from the Volunteer Association.
We are very proud of the work that's been done so far with the Family Care Grant Program and look forward to hearing from the grant recipients about the impact these grants have made for patients and families. I'd like to thank each of our speakers for being with us today and sharing a little bit about what goes on at the Health Sciences Center. This now concludes the formal portion of our agenda. For members of the media, all of our speakers are available for interviews. We also have a photo opportunity that will take place in the Multi-Faith Center, which is just down the hall from us. Thank you to everyone for attending and have a great day.
Thank you very much.